Hello, and welcome to the Kansas State Veterinary Diagnostic Lab YouTube channel. This video will demonstrate fecal centrifugation and the use of the SNAP test for diagnosing Giardia in dogs and cats with clinical signs. To begin, let's review three critical points in the diagnosis and treatment of Giardia. Number 1, 20% of positive animals do not shed cysts on any single day. Therefore, testing 3 days in a row is required to declare an animal negative. Number 2, cysts are shed in wildly varying amounts. Therefore, you cannot correlate the number of cysts found in testing to the severity of the disease. And number 3, any treatment regimen should include bathing the animal, as cysts will be found in the hair and can easily reinfect the animal. Centrifugation. To begin, mix 2 to 5 grams of fresh feces, about the size of a quarter, with 5 to 10 ml of flotation solution in a beaker. For this test, you will need to use zinc sulfate with a 1.18 specific gravity. Pour the mixture into a centrifuge tube after straining through a kitchen or tea strainer. Next, add flotation solution. Fill the tube to within approximately 1 centimeter of the top. Place the tube in your centrifuge, balance it, and spin for 5 minutes at approximately 1300 RPM. You can use a swing head or fixed head centrifuge with equal success. Remove the tube, place it in a rack, and slowly fill with your flotation solution to form a slight positive meniscus. If you use a squirt bottle for this step, be careful not to cause turbulence in the centrifuged fluid, as this will drive the cysts that are floating deeper into the tube. Cover the tube with a cover slip and let it set for 10 minutes. This allows the cysts to float the last 1 centimeter. Place 1 drop of Lugol's iodine on a microscope slide. Remove the cover slip, place it onto the iodine drop, and examine for cysts. The SNAP test. Remove the test kit from the refrigerator and let it warm to room temperature. Remove the test kit from the foil pouch. Pull off the tube that covers the conjugate's swab device and coat the entire swab tip with a thin layer of fecal material. Replace the tube over the swab. Break the plastic valve stem inside the reagent bulb by bending the assembly back and forth at the neck. Hold the device swab tip down, squeeze and release 3 to 5 times to pass the conjugate's solution in the bulb to the swab tip. Place the SNAP device on a flat surface. Using the swab bulb as a pipette, place 5 drops of the sample solution into the sample well of the SNAP device. Be careful not to splash the contents outside the sample well. The sample will flow across the result window, reaching the activation circle in approximately 30 to 60 seconds. When the first sample appears in the activation circle, push the activator button firmly until it is flush with the device body. If the sample does not flow to the activation circle within 60 seconds, press the activator button after the sample has flowed across the result window. Wait 8 minutes, then read the test result. Test result interpretation. The test is positive if the color on the sample spot is darker than the color on the negative control spot. The test is negative if the color on the sample spot is equal to or less than the color on the negative control spot. We would like to thank Dr. Michael Dryden and his expert technicians for their assistance in producing this video.